Okay. Miss Priscilla Aqua. And okay, you, Priscilla. Priscilla. Not Priscilla. Priscilla. Okay. What's the difference?
Okay. Priscilla, it's just like a princess. Okay. So
Okay.
it's another name for a princess.
Another way of saying it.
Yes, please.
Okay. I thought it meant something else. Anyway, and of course, Meshach Nyanzu. Meshach.
Yeah.
Okay. Nice to have the three of you in studio.
Thank
Uh,
you.
And how are you all doing?
We are doing well by grace. We are fine.
Yes. I understand you are doing. Is it your week?
Yes.
SRC week.
Yes.
SRC week celebration.
Yes.
Okay. So are you members of the SRC?
Yes, the two of us.
The two of you.
Yes, please.
You are the outlier.
Yeah. Professor.
Our professor.
Oh, he's a professor.
Yes.
I'm just a member of the academic board.
Are you a lecturer or you are?
No, I'm also a student.
You're also a student, but a member
of the academic board.
A member of the academic board.
Yes.
Okay. And the two of you are members of the SRC.
Yes, please.
Okay. What position do you hold,
I'm
Principal?
the academic rep or academic prefect.
Academic prefect.
Yes, please.
Oh, okay. So you are the lady with the brain.
Yes.
Okay. And then Justice.
I'm the PRO.
You speak for.
Yes. Voice
Spokesperson.
of the voices.
I see. Nice to have you in studio.
Thank you very much.
And so far, what have you done as? I don't know. I think I start with PRO. What have you done as part of the SRC week? What's the plan?
Oh, okay. So today we are doing our old school feast.
Okay.
Yeah. So we are remembering the activities of our forefathers, how they dress, the
Okay.
things they do.
Okay.
So we are dressing in that style, and then we
Okay.
are going to lectures this morning.
Okay.
In those dresses.
You are old school.
Yes.
Yes.
So when do you intend to change into the old school? Because I don't see
We
the
were in old school attire
Yes.
before we have to actually.
okay. You had to brand
Yes,
yourself
yes.
properly for okay.
So as soon as we close,
You change back.
to our roots.
Okay, that's an interesting one. Oh, and then what else? What else follows?
Okay. So this evening, we will be having our bonfire. This evening.
Okay.
Yes, and then tomorrow we'll be doing our float.
Okay.
And so we'll be marching across the principal streets of Kolibu, Kolegono.
Okay.
And then educating the public on conditions of the eye.
Okay.
Yes, and then letting them know what we do
Okay.
as a profession. You know, many people don't know much about ophthalmic nursing.
Okay.
And then many people don't have that preview about their eye. And then when they report, things are already bad before they come.
Okay.
So you want to give them that education as we march across there. And then that Sunday, we are having our worship and then night. And then you invite some artists to come and then.
Okay, you enjoy.
Yes, enjoy.
The rest
also.
of it will continue.
Okay.
Then you have to wake up on Monday and go back to school.
Yes. Oh, we are continuing from that.
Continuing
Yeah, it's a whole week.
The
Next week, the whole of next week
yes.
is fully packed.
Oh, I see.
Yes, the whole of
It's
next
up
week.
to the 3rd, right?
Up to the 3rd of May.
Yes.
Okay. Now, then let's start by you have to introduce yourself properly. What is ophthalmic nursing? What do you do?
Okay, so thank you once again, and good morning to your listeners. When we talk of ophthalmic nursing, we are looking at the eye.
Okay.
We mostly look at conditions that affect the eye.
Okay.
We treat you.
Okay.
And your recovery is our ultimate goal.
Okay.
Your ability to be able to see. Okay, so basically that is what we do. It's a 2-year course and it's a post-basic course. Okay, so after your diploma as a nurse, if you want to upgrade, okay, you can just come, and it goes like you going for the interview. When you qualify, then you are given admission to pursue it. So it's a 2 years and then it's a degree course.
Okay.
Yes, basically that's what we do. We look at your eyes.
Okay. So the focus is on the eye,
yes.
Your vision, your ability to see.
Yes.
Okay. So the three of you plus everybody in that particular the ophthalmic department decided that specializing you do the eyes.
Yes.
Okay. It's quite an interesting case. Okay, but you're qualified nurses already.
Yes,
Yes.
please.
Okay, so you're working in hospitals before you decided to
Yes. At least,
advance.
sorry, to add to it, you should at least have at least 3 years experience. Yes.
Okay.
Working as a nurse.
Okay.
It can be a general nurse, a midwife, a community nurse. At least 2 years, 3 years experience. Then you qualify to come to the ophthalmic nursing school.
Oh, okay. Okay. But first, let's start with some basic concepts on your eyesight. Exactly. Okay. So one of the concepts that come up is visual impairments. Okay. When you say visual impairment, are you saying the person is blind? Exactly what is your concern when it comes to the eye?
All right. Okay. So basically, when we are talking about visual impairment, we are looking at a vision that is very poor, that you cannot see clearly.
Okay.
So that when that happens, it means that it's going to interfere with your daily activities. But when we are talking about blindness itself, it is a severe form of the visual impairment.
Okay.
That maybe you are completely blind, you don't have the sight to see.
Okay.
So blindness is different from the visual impairment. So the visual impairment, you have some amount of vision left, but blindness, you might lost everything.
You have lost it completely.
Yes, that is the general definition for the blindness. But when you come to our end, medically, when we say blind, we are looking at a different category of it. Okay. So when you come to our end, we have to take you through a test. And after the eye test, we will come out that you are blind. And our test will tell us that what a person with a normal vision is seeing at 60 meters away. You, that you have the visual impairment, you are seeing it at 6 meters.
Okay.
So when it comes in that way, then it means that you are blind. So something that somebody is seeing at 60 meters, then you are seeing it is 3 meters rather. So you are seeing it at 3 meters. So it means that you are blind totally.
The definition of blindness.
So
I
in
think
general,
blindness is you can't see at all.
Yes. So when you come to our end, the narrative is different.
Okay.
Yeah. So to the layman person, you can't see at all. But when you come to our end, we'll tell you that what a person with a normal vision is seeing at 60 meters, you have to come as close as 3 meters to see that particular thing. So you see that when you come to our end, the narrative is different.
That's quite an interesting definition.
Yes.
Because we will say your eyes are not, that's what we say, your eyes are not good.
Yeah.
Means you can't see at a particular reasonable distance. You're saying that the definition of blindness medically is different from what we think.
Yes.
Okay. So what happens if you can't see at all? You can't see anything. Do you still fall under blindness?
Yes, I will say for the blindness we have like gradings.
Okay.
We have some that, as my brother have said, maybe when they bring an object to, let's say, 3 meters distance, you can see. Some may not see, but may perceive light.
Okay.
As in, if you throw light to the person's eye, the person can see the light.
Right. Okay.
Some, they may not perceive the light at all. Yes. So those categories, from the 3 meter distance observation to no perception of light, they all are categorized into what? Blindness.
Okay.
Yes. So as you have said, the worst form of visual impairment is the blindness.
Okay. Okay. So, then now take us back to what visual impairments. Are you talking about one type? Are there different types, or there's only one classification of visual impairment?
All right. So basically, we have 2 classifications of the visual impairments. So it is either you find it difficult to see something that is far from you, that is the distance visual impairment, or you have difficulty seeing something that is closer to you, and that is the near visual impairment.
Okay.
So basically, we have 2 types. But when we are talking about the distance visual impairment, when you come to our end, we'll also have to take you through some tests. And the test will put you in a category whether you are at the mild form of the distance visual impairment, or the moderate form, or the severe form, or you are in the zone of blindness.
Okay.
So basically, that is how it is. So to the layman's understanding, we have 2.
Okay.
That is either you have problems seeing something that is far from you, that is the distance visual impairment. Or when you have problems seeing something that is closer to you, that is the near visual impairment. But until you've come to our end, we will not know the category under the distance visual impairment that you fall under. So we will put you at whether you fall at the mild form of it, the moderate, the severe, or in the blindness zone. So until you've come and we've put you through that test, you might be sitting at the house and you'll be thinking that your own visual impairment is the distance one. That is what it means. So until you've come, you wouldn't know. Maybe your own is the mild form, the moderate, the severe, or the blindness. So basically, that is how the categories are.
Okay. Why is this a major concern when it comes to visual impairments? There seems to be, in fact, I have done other interviews on this issue of visual impairments, and there's a global concern. Why is it such a big issue?
Yes, it is a global concern to us because globally, about 1 billion people are having this visual impairment.
Okay.
And which, of course, most of the causes of the visual impairment were treatable, and some were even preventable. When you bring it down to Ghana here, you realize that this visual impairment, from statistics, it will tell you that about 0.74% of Ghanaians are blind.
Okay.
Which literally means that 7 out of every 1,000 people we meet may be blind. Then about 1.07% have the severe vision problems. That is roughly 1 out of every 100 people struggling seriously with their sight. And out of all these, you realize that more than half of them are female.
Really?
Yes, more than half of them are female. And this is based on the longevity paradox. That mostly we will say that women live longer
than men.
Yeah. And as we go on, you will understand that we have most of the conditions that predisposes one to be having the visual impairment being age-related. So when it means that the longevity paradox is saying that the females live longer than men, then it means that they are at a higher risk of even developing it. So that is basically what it means.
Over time?
Yes.
Okay. That's quite interesting. Please go through that. You said 0.74%.
Yes. So 0.74% of Ghanaians are blind. So what it means is that 7 out of every 1,000 you meet may be blind.
I see.
Yes. Then 1.07 have severe vision problems. That is roughly out of every 100 people struggling seriously with their sight.
1.07?
Yes.
That's quite high.
Yes. That makes it a global concern to us.
And Prinsela, what are the major causes of this?
Okay, so first of all, we are looking at some basic conditions. Okay, when it starts, mostly we take it as a normal eye problem. So you don't seem to take any responsibility regarding how to manage it. So we can talk of uncorrected refractive errors. When we say refractive errors, we are talking about amount of light the eye is able to send it to the back of the eye for it to focus on an object. Okay. So you see this person that is having problem with the sun or light. Okay. So if someone complains or has this kind of problem and it is not corrected, you are at risk of having visual impairment. So we call it uncorrected refractive errors. We are talking about glaucoma. Recently, we had glaucoma week awareness. Okay, so if you have glaucoma, which we know that it causes increase in the pressure of the eye has pressure. Just as you check your blood pressure and say it's high, the eye has pressure. So if you come to the hospital, we use our tools to check, and then we realize that the pressure is high. We check the back of the eye. That is what makes us special with our ophthalmoscope. And we realize that the optic nerve is beginning to fade off. Then that is when we say that this person is having glaucoma. And you're also at risk of visual impairment if you decide not to act quickly. If you don't act quickly, then you're at risk of developing visual impairment. We can also talk of trachoma. You see, trachoma is a chlamydia infection. So if you are the type that you don't have this sanitation in your environment, you are the type that you are always touching your eye with filth, okay, and you are infected with this trachoma, if it is not treated early, you are at risk of developing visual impairment. We can talk of diabetic retinopathy, which is mostly in the diabetic patient. Okay, people have diabetes without even knowing, but as specialists, when you come to the clinic, we check your eye and we are able to tell you that go and check your sugar. You go and check and then come back and tell us that, hey, the sugar was high. And all these things, they predispose you to getting, to going blind or becoming visually impaired. And finally, I'll talk about cataract. Okay, cataract is the opacity of the lens. The eye has a lens, okay, which helps us to see. So when with age, sometimes with age, 40, 45 going, it becomes opaque, like blurred eye, kind of something. So when it happens like that, some of the time we do not know. So you say that you go and buy some medication and drop on it, thinking that it will go. That one, it won't vanish. It will not go. Unless with surgical treatment or surgical correction. That is when they remove the opaque lens and then they give you a different lens for you to see clearly. So some of the conditions, they can be managed for you to come back to the normal way you see, or for you to retain your normal vision. Whilst others, they can be managed so that the vision you have, at least it can be retained, it can be maintained for some time. And then others too, the best is treatment for a very long time. So these are just a few of the causes.
Unfortunately, you see the man behind me, we've eaten into his time. We have to end this. But when I listen to both of you, I get the impression that the advice is you must get it checked. And the correction done early. If not, you have a problem. So let's then deal with, what do you recommend to the general public? At what point in time do you think, because the signs they should see, and when they see the signs, what should they do? Who do I go to? The PRO.
So I will say that if you have any symptom at all, just visit the nearby clinic. If they have an eye specialist over there, they will check and then tell you exactly what the problem is. So frequent visiting of the eye clinic, I think it will be the best option. If you have any issue at all, don't relent. Just go to the eye clinic. Let the specialist see you. And then also take some measures to prevent yourself from getting any kind of infection with the eye. Especially the statistics say our female are highly predisposed. Some of them cosmetically, they touch their eyes too much. Fixing of eyelashes, dropping things on their eye, the contact lenses. If you can reduce some of those things, I think it can help us, in preventing some of these things. So basically, as you have said, visiting the eye clinic when you have any symptom at all, it will help early diagnosis and then early intervention. Thank you very much.
So this education is part of your SRC week celebration?
Yes.
You'll be doing this in the community too?
Yes.
Okay, I see. Interesting. So I'll give Priscilla, if you have a message for those who are listening, and then I'll come to you, Prof. Yes.
Okay, so thank you for having us once again. So the message is that if you have a problem with your eye, don't use herbal preparations that are not FDA approved on your eyes. Please visit the hospital, eat well. We understand that some of the foods rich in vitamin A, kontomire, your carrots, your eggs, your meat, eat well, so that all these eye diseases, you will not be predisposed to it. Thank you.
Okay. Prof?
All right. Okay. So my final words to our cherished listeners is that, dear listeners, your eyes are your window to the world. Most blindness can be prevented or treated, but only if we act early. Let us take responsibility for our eye health. Let's go for regular checkup and encourage others to do same, because a better eye is truly a better future. Thank you.
Great. He is not a professor yet, but it seems they've predicted his future already. He's on the track to professorship. He's a student at the ophthalmic nursing school at Kolebu. His name is Meshach Nyanzu. Starting from my left, in the middle, of course, the lady, Prinsela Aqua. And then there's Justice Dejo. Justice Dejo is the PRO. So when the problems start, they say, go and say something. If you don't say anything. So he is an important part of what they do. They are celebrating their SRC week. There's a lot that will happening this weekend. It goes through next week till 3rd May. It's not all enjoyment. There's some work, education, among others. So wish you all the best in the celebration of your SRC week.
Thank you.
I think we also want to thank you so much for giving us this opportunity to come and speak to the public. And then we also want to invite more public to come and sponsor the program for us. We need
sponsorship.
Yes, we need sponsorship. So we need all hands on deck. They should come and then sponsor the week for us. And then we also want to thank all those who have already sponsored.
Okay.
We all want to thank them so much for helping us.
Who have come on board?
Oh, okay. I think Akade can mention a few
who have come on board. At least acknowledge them so that it will encourage others to join.
Okay, so first of all, we'll talk about Wartburg Eye Services.
Okay.
At Kaswa.
Okay.
Yes, so they've been so helpful to us. We say thank you. We also have Stocho Trading.
Okay.
They deal with this organic products.
Okay.
So we say thank you. Dr. Ofori, he's an ophthalmologist in USA.
Okay.
Okay, he has brought us some goods from USA. Doctor,
that's
we say
great.
thank you. We have Bandes Gary Mix.
Oh, yes. Yeah. Gary Mix today is
yes.
Oh, they say Gary, they give you blindness.
It's mixed with a lot of nutrients. So, yes, try that Gary Mix. It's also good. Okay. We have Kolebu Teaching Hospital CEO, Dr. Adams. Yes, he has also been helpful. Doctor, we say thank you. God richly bless you. And then Mr. Sankudele.
Okay.
Yes, we say thank you very much. All the executives from GRNMA, from UPNMG, our mother association, the GONS, we say thank you and we appreciate what you are doing for us. We are expecting more. We are expecting to see you too on Monday at the symposium, the actual launching.
Okay.
Yes. So we thank you and we appreciate you a lot.
And so Radio Gold.
Radio Gold. Yeah.
So
thank you.
Thank you.
And thank you very much for joining us. What's the name of the gentleman behind me?
He's our Reverend Obed. Yes. Reverend Obed.
Well, I didn't see Reverend Obed. But thank you very much for making time to join us in studio. I wish you all the best.
Thank you.
And from us here at Radio Gold, the Gold Morning Conversation, thank you very much for making time to join us this week on the Gold Morning Conversation. We are back Monday with other editions of the Gold Morning Conversation. I'm Sana Nombo. The rest of the team, Nancy, SM, Eric, Patrick, Alaska B. We say a big thank you to all of you. Once again, our condolences to our brother David Sichope Tamakulu. Coming up next,